So this discussion is trying to understand the linkage between motion at the talocural joint, subtalar joint, and mid-tarsal joint, which consists of talonavicular and calcaneocuboid joints. Here we can see an illustration of how tibial rotation affects foot movement. It's clear that tibial rotation makes the arch raise and lower. So the tight fit between the ankle mortise and trochlea of the talus when the calcaneus is fixed to the ground allows rotations of the tibia to induce talar motion, which then in effect causes subtalar motion. So in this diagram here, we can see that internal tibial rotation causes adduction of the talus and eversion of the subtalar joint. This motion then has effects on the mid-tarsal joint. But to understand how the effects happen, we first have to understand the axes of the mid-tarsal joint. So treating the calcaneocuboid and the talonavicular joint as one joint complex, we can identify two axes. There's a longitudinal axis that's nearly aligned with the anatomic anterior-posterior axis. So then you'll have eversion and inversion of the forefoot occurring around this axis. There's also an oblique axis, which is seen down here in B. And this axis is 52 degrees from the horizontal and 57 degrees in the sagittal plane. So it neither lies in the frontal or the transverse or the sagittal plane. So it's halfway between, really, the transverse plane and then the sagittal plane in terms of motion. So this alignment means that motion around this axis will include about half in the sagittal plane, so plantar flexion and dorsiflexion, and about half in the transverse plane, meaning adduction and abduction. So another way of saying this is that dorsiflexion and plantar flexion and adduction and abduction around the mid-tarsal joint are coupled. Just to reiterate, so here's the longitudinal axis, which is nearly aligned with an anterior-posterior axis, and so we'll have motion of the distal bones to the mid-tarsal joint, so the midfoot and forefoot, which we'll just call the forefoot right now, will move an eversion and inversion around this axis. And then for the oblique axis, motion can occur that's coupled between adduction and plantar flexion or dorsiflexion and abduction. So here we're going to explore the relationship between tibial rotation, subtalar motion, and then allude to the forefoot motion that might occur. So on your left, you see tibial external rotation shown on this diagram. And this is coupled to hindfoot or subtalar inversion. We look at tibial internal rotation. What we notice is that this now is coupled to hindfoot or subtalar eversion. What we're going to notice as we look at data is the connection between the subtalar motion and the mid-tarsal joint motions is going to be more complex. So we're going to get motion around one axis but not another. Setting that aside for a minute, what you're going to notice and what's illustrated in the picture here is that in a standing position, when you externally rotate your tibia, you'll have increased lateral foot contact with the floor, which would be forefoot inversion. And when you internally rotate your tibia, you're going to have increased medial foot contact with the floor, which would be forefoot eversion. So why is this important? Well, theoretically, we need a way to stabilize the midfoot so it doesn't flex or extend when we're moving. So one mechanism has been proposed has been the locking of the mid-tarsal joint axes. And so essentially here we see the individual axes of the talonavicular joint and the calcaneocuboid joint with the subtalar joint in neutral. So we can see pretty good alignment here between the talus and the calcaneus. And notice that the axes are in parallel. When you invert the calcaneus at the subtalar joint, what you notice is that the axes are no longer in parallel, and that this lack of parallel alignment locks the mid-tarsal joint, preventing movement at the talonavicular and calcaneocuboid joints. This, in effect, prevents plantar flexion and dorsiflexion of the midfoot. And we can see here during gait, so this is a gait trial, we see inversion and eversion of the calcaneus relative to the tibia plotted here on the y-axis, and then the stance phase of gait on the x-axis, where 0 is heel strike and 100 is toe off. We want to focus on the gray line, which is control participants. We can see that at initial contact, the subtalar joint position is near 0, but it rapidly goes into eversion, meaning that the mid-tarsal joint's not locked, and that there's greater flexibility at the mid-tarsal joint in plantar flexion and dorsiflexion. But then as we go toward late stance phase of gait, when we're lifting our heel up and putting weight on the metatarsal heads, what we notice is that the subtalar joint moves into inversion. This movement into inversion causes this non-parallel axis we see here in this picture, locking the mid-tarsal joint and preventing dorsiflexion, plantar flexion of the midfoot. So we look at gait patterns across a large number of subjects. There's essentially 4 typical patterns that have been shown statistically. And again, here we have the frontal plane motion on the y-axis and then the stance phase of gait on the x-axis, where 0 is heel strike and 100 is toe off. You can see eversion is negative here and then inversion is positive here. Essentially, these are the variety of patterns that we see, and all of the patterns show this kind of inversion and late stance, suggesting that it's necessary to use this mechanism to lock the mid-tarsal joint for push-off. And then we see some variability that's normal in terms of how much eversion occurs earlier in stance. And this pattern here kind of stands out as this kind of early eversion pattern or early pronating pattern in these individuals. So on this graphic, we're going to look at the correlation between shank motion, subtalar motion, and foot motion during running. This is different than walking because there's much more rotation of the shank during running than walking. So first, let's look at the shank motion, which is down here in this left bottom corner. The angle of the motion is here on the y-axis with internal rotation being negative, and then the stance phase of running is on the x-axis. So we can see that 0 is heel strike and 100% is toe off. See that from heel strike to toe off, there's a pattern of internal rotation followed by external rotation toward 100% of the gait cycle. If we look at the subtalar joint, which is here, i.e. the rear foot relative to the tibia, we see eversion is negative and inversion is positive across the stance phase. And we see the same kind of pattern where essentially there's eversion across the stance phase of gait until about 80%, and then there's inversion at the terminal part of the stance phase of gait. So essentially the rear foot pattern and shank patterns are correlated, suggesting that the tibial rotation is actually inducing part of this subtalar motion. Here to the right, we have the forefoot motion around the longitudinal axis of the mid-tarsal joint, so eversion and inversion. And then we have the forefoot movement around the abduction, adduction, or oblique axis, which would then kind of explain abduction, adduction, and flexion extension. So we can see first of all is that despite this shank motion, the forefoot motion around the longitudinal axis is highly variable, meaning that there's no correlation between motion around the longitudinal axis and the shank. But if we look at motion around the oblique axis down here in the bottom right, there's an almost exact imprint of the joint angles, suggesting that the motion in abduction and dorsiflexion would be occurring here as the joint is internally, as the shank internally rotates, and then adduction and plantar flexion would be occurring here as the shank externally rotates. And so this fits nicely with the idea of arch raising and lowering. And so we can see with this data is it appears that shank motion is more effectively linked to the oblique axis than it is to the longitudinal axis of the mid-tarsal joint. So in summary, this data shows that shank subtalar joint movement during weight bearing. We know that the shank internal rotation is linked to subtalar joint eversion, and shank external rotation is linked to subtalar joint inversion. Mid-tarsal joint movements, there's two axes, eversion and inversion occurs around the longitudinal axes, plantar flexion with abduction, adduction, and dorsiflexion with abduction around the oblique axis. That the mid-tarsal joint locking mechanism is subtalar joint inversion, locks the mid-tarsal joints and makes the foot more rigid. Subtalar joint eversion unlocks the mid-tarsal joint and makes it more flexible. The linking motions during running are illustrative of how the foot works. Essentially, the shank internal-external rotation is coupled to subtalar joint motion, but when we look at shank motion relative to the forefoot or at the mid-tarsal joint, only motion around the oblique axis is linked to motion at the forefoot.